Thank you very much. I think we were supposed to finish this session at 3 o'clock and we are going on borrowed time. We will certainly go ahead with the last presentation. Dr. Kulathunge. Dr. Kulathunge holds an MBBS, a postgraduate diploma and an MD in venereology from the University of Colombo and currently serves as a senior registrar in venereology. With extensive experience in primary health care, Dr. Kulathunge focuses on research and care provision for marginalized groups, including LGBTQ communities, with primary research areas in STI treatment, HIV, and LGBTQ health. Actively engaged in clinical audits, sexual health promotion, and electronic patient data management. Dr. Kulathunge is dedicated to advancing inclusive sexual health care and education. Please go ahead.
Thank you, sir. Thank you, madam. Good afternoon to everyone. Let me present our study finding, Decoding Perspectives, Insight of Government Medical Officers in Sri Lanka on Homosexuality, a cross-sectional analysis. I'm Nalaka Kulathunge and my supervisor is Dr. Ariyaratna Manathunga. As we all know, human gender and sexuality is falls into a wider spectrum, and it's not static and it's not binary. And certain so-called gender minority people do have their own set of sexual health needs in addition to the other common needs. Healthcare providers' attitude and knowledge will invariably affect the healthcare delivery, and understanding these will promote more inclusive healthcare environment to all. So with this background, we developed this research to identify the knowledge on homosexuality among doctors employed under the Ministry of Health, Sri Lanka. This is a descriptive cross-sectional study, and all the medical officers who were employed during the time period of the study was included, except who has not given email addresses and as well as intern house officers, because those data are not in that the ministry. So we have employed the simple random sampling. The calculated sample size was 384 with a modest response rate of 51.1%, and we have used the sex education knowledge about homosexuality questionnaire or SCKHQ without any alterations to gather the data, and it is an online data questionnaire, and we use the Google Forms to anonymously collect the responses. So most of the respondents belongs to the age category between 35 to 44, and as you can see here, male and female are more or less in equal representation. But interestingly, 2.3% of the responding doctors identified themselves as gender non-binary, and this is how the scores have been distributed. It is more or less like a normal distribution curve. The statistical analysis shows a mean score of 13.5 and also a narrow confidence interval. And after reviewing the past studies as well as getting the expert opinion, it is decided to consider the people who have scored more than 50% to have a better knowledge on homosexuality. So as you can see here, most of the respondents, about 64%, can be considered as having poor knowledge on homosexuality. Analyzing further, in this questionnaire, it has 32 stems, true or false stems, and of that, 6 stems receives less than 20% correct answers. And one interesting finding is the same study, same type of the questionnaire used and study done in India had recorded the same 6 stems having lowest responses. On the other hand, only 2 stems had recorded more than 80% correct answers. I want to highlight this because these kind of findings can be maybe due to the prevailing myths within the society. They can foster more misconception within the society, and mind you, we are doing this on medical doctors. Statistical analysis shows that there is a statistically significant association with exposure to the LGBT patients. It's a p-value of 0.007, and so do with the having LGBTIQ relatives or friends. That's also there's a better knowledge when they have either relatives or past exposure to the patients. Though statistically not significant, male doctors had a higher average compared to the females. Then gender non-binary doctors scored higher than the gender binary doctors. Also, young doctors had a higher average again, and certain ethnicity had higher average than others. And also the doctors who are single had a higher average, and also doctors who have not following any religion had a higher average. Another addition was that they were living in a Western country, and also the doctors who have schooled in Colombo. Colombo is the more urbanized area in the country, had a better average. Another part of the study was we inquired whether they have ever had a formal training on LGBTIQ. The doctors who had LGBTI training in the past had a narrow discrepancy between the good and bad. As you can see here, about 51% had a poor knowledge. But in contrast to that one, the doctors who never had that one, 66% had poor knowledge. Overall, this reflects a poor knowledge about homosexuality among doctors. In fact, the personal and professional exposure may enhance the understanding because both are statistically significantly associated with good knowledge. Male gender, young age, not following any religion, and past residence in Western country also positively associated with, though it is not statistically significant. Let me tell you a little bit about the limitations as well. We choose this study design because it's cost effective. Low response rate is a concern, maybe due to unfamiliarity with the online questionnaires. As you can see, most of the old age group doctors was not responded. Again, the reservation about the topic. Some may have special reservation and they didn't respond. But nevertheless, confidence interval is narrow, as well as the post-hoc analysis done on this study give a very high statistical power. So findings are representative to some extent. And selection bias and self-reporting issues can be there. A little bit about the other studies done in the region. I could find only 2 studies done in Sri Lanka in the same period where I was done the study. Both studies, the one is on doctors and one is on the medical students. Both had a better knowledge on homosexuality compared to our study. But one Indian study is more or less similar to our one, showed that doctors have poor knowledge on homosexuality. And there is one interesting study done in Switzerland. It is an interventional study. It shows that receiving interventions improve the knowledge of doctors. I think we need to give more familiarity within our medical education, not only the medical education, even in the school education on this gender diversity. Technical and formal training on education may improve the clinician's knowledge and will also foster more increased responsiveness of doctors towards these kind of communities, as well as reduce discrimination and also enhance confidence in providing care to these LGBTI individuals. So these are my references. Thank you.